Hi everyone, my name is Allison Liv, and I will be talking about etiology and reservoir for HIV. So HIV stands for Human Immunodeficiency Virus. So since it's a virus, that means there isn't a gram stain, unique structures, and there's no way to see if it is motile or non-motile. The morphology of HIV is icosahedral. So we can see here, it looks like a 20-sided die. The genome for HIV is single-stranded RNA. So in this diagram we have here, we can see that there's a viral envelope around it. There are also different parts to HIV. There are envelope spikes, which helps with attachment to a host cell. There are also protein capsids right here, which is like the shell of the virus in the middle. We can see the RNA genome, what happens when the virus infects a cell, a new mutation is possible. There are two strands of HIV, which are HIV-1 and HIV-2. The strands are then divided into subgroups and then further divided into letters. Group M, HIV-1, is the one responsible for the HIV epidemic. When a patient receives treatment for HIV, it depends on the strain and subgroup they have. The reservoir for this virus is humans. A similar virus called simian immunodeficiency virus was passed to humans and mutated into HIV. It is likely transmitted when humans hunted chimpanzees for food and they got infected with infected blood. The way HIV works is that it attacks the human helper T cells in the immune system and can mutate quickly. It can also be found in blood, semen, vaginal, cervical, and rectal secretions, and breast milk.
Hello, my name is Laura Snyder, and I will be discussing the history and prevention of HIV. Chimpanzees are believed to have transmitted the simian immunodeficiency virus, SIV, to humans through their meat and blood resulting from hunting. The chimpanzees were infected from eating two different types of infected monkeys, the red-capped mangabes and the greater spot-nosed monkeys. This produced two different strains that infected chimpanzees and created a third called SIV-CPZ that could be passed between chimps and to humans. The hunter's body would fight off SIV, but on occasion, SIV would adapt to the human host and become HIV-1. Each time SIV was passed from chimpanzees to human, the virus would develop differently, producing a different strain, explaining the many strains of HIV-1. HIV-2 comes from sooty mangabe monkeys and was transmitted in a similar way of that of HIV-1 from hunting. HIV-2 is a far rarer form of the disease and is mainly found in a few countries in West Africa. The first documented confirmed case of HIV in humans through a blood test was in 1959 from a man living in Kinshasa in the Democratic Republic of Congo. From this first diagnosis, scientists have determined that SIV transmitted to HIV in 1920 in the same geographical area. This area had sex trade and a lot of transport at the time, which promoted the spread of the virus. In 1981, a few cases of the virus appeared in the United States, but at that point had developed to what we know as AIDS. Because this virus wasn't known and people weren't getting tested, the virus could have been in the United States earlier than this.
Hello everyone, my name is Catherine Ramos and I have been assigned the signs and symptoms and transmission of HIV virus. So HIV stands for Human Immunodeficiency Virus, meaning the virus can only infect humans. The immunodeficiency weakens your immune system by destroying important cells that fight disease and infections. These cells are called the CD4 cells or the T cells. If left untreated, HIV will destroy many CD4 cells, preventing your body from fighting these illnesses. Some of the symptoms of HIV vary depending on the stage of the affected individual. In the early stage of HIV, within 2 to 4 weeks after contracting the virus, some common symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and mouth ulcers. The second stage of HIV is called the clinical latency stage, or the chronic stage of HIV. During this stage, HIV is still active but reproduces at very low levels. People who are in this stage may not experience symptoms at all or may confuse them with the flu-like symptoms, making the HIV virus so dangerous because with left untreated and without the antiretroviral therapy, people in this stage can last for decades, or they may proceed to AIDS, the final stage of HIV, much more faster than if they were on therapy. The final stage of HIV is the progression to AIDS. People who are not on the antiretroviral therapy will move into the latter stage of the HIV called AIDS or the acquired immunodeficiency syndrome. Some symptoms include rapid weight loss, recurring fever, profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph nodes in the armpits, groins, or necks, diarrhea that lasts more than a week, sores in the mouth, anus, or genitals, red, brown, pink, or purplish blotches under the skin or inside the mouth, nose, or eyelids. It's also important to understand the transmission of the HIV virus. There's a common misconception that HIV is transmitted through saliva, sweat, tears, close mouth kissing, sharing foods or drinks, and that is not true. HIV is transmitted through unprotected sexual activity and the syringe used. In the US, HIV is spread mainly through oral, vaginal, or anal sex without the protection of the condom. Sharing needles or syringes, rinse water, or other equipment works used to prepare drugs for injection with someone who has HIV. HIV can live in a used needle up to 42 days depending on the temperature and other factors. Common drug users are at a higher risk of contracting the HIV virus because they tend to use the same needle for drugs, and a person infected with HIV may use that same needle and give it on to someone else. They are also not within reason, and they tend to have sexual activity with partners that they do not know, and unprotected sexual activity leading to a higher risk of contracting the HIV virus. A less common way that HIV may be spread is from mother to child during breastfeeding, birth, or even pregnancy, and the risk is higher if the mother is not taking the treatment.
About 1.1 million people in the United States are living with HIV, and of those 1.1 million, about 166,000 are unaware they have HIV. In order to prevent the spread of HIV, people need to get tested to know whether or not they are HIV positive. Once tested, whether HIV positive or negative, there are precautions that every individual should take to prevent the spread of HIV. As we learned earlier, HIV is transmitted through bodily fluids, including blood, vaginal, cervical, rectal secretions, breast milk, and semen. Because HIV is transmitted through blood, it is important to use a new needle for each injection. Sharing needles increases the risk of HIV transmission. HIV is also transmitted through sex. Abstinence is the only sure way of completely preventing the sexual transmission of HIV. Not having any type of sex substantially limits your contact with infected HIV fluids. The type of sex with little to no risk of infection would be oral sex, unless the individual had open sores in the mouth, which would increase the chances of transmission. The riskiest activity for an HIV-negative person is being the receptive individual in anal sex. The receptive partner is 13 times more likely to get infected than the insertive partner. This is due to the lining in the rectum being thin and allowing HIV-infected fluids into the body. Being the insertive person in anal sex or having vaginal sex carries less risk. However, HIV can still be transmitted. Women can get HIV from vaginal sex because the fluids in the vagina and cervix may carry the HIV-positive fluids from an infected male into her body. Men can get HIV through the opening in the penis, the foreskin, or any other openings, including scratches or cuts. Because a man can get infected through the foreskin, circumcision reduces the risk of infection. In order to reduce the risk of getting HIV through any type of sexual contact, condoms and lubricant should be used correctly and consistently. Condoms should be inspected for any openings or potential weaknesses and should be used well within the expiration date. A new condom should be used with each sexual activity. Lubricant should be used to prevent the tearing of the condom during the sexual encounter. Pre-exposure prophylaxis, PrEP, is another way to prevent HIV infection. People who are sexually involved with an HIV-positive person can take Truvada consistently to reduce the risk of HIV infection by up to 92%. People who use PrEP must commit to take Truvada every day and get a follow-up every 3 months. Taking Truvada in addition to using condoms decreases the risk of HIV infection even more. In addition, if the infected individual is being treated, the risk is much less. If there was a single high-risk event, antiretroviral drugs must be used as soon as possible or within 72 hours of the event to stop HIV seroconversion. This is known as post-exposure prophylaxis. Treatment through antiretroviral therapy, ART, for people who are HIV positive also acts to prevent the transmission of HIV through sex, needle sharing, or mother-to-child during pregnancy and birth by lowering the amount of virus present in the infected individual. A lot of people can get HIV from making bad decisions resulting from drinking alcohol or doing drugs. Reducing the amount of drug and alcohol consumption is also linked to decreasing the risk for becoming HIV positive. When people are not in control of their faculties, they are more likely to share needles and have unprotected sex with strangers. Limiting the amount of sexual partners and knowing HIV status reduces the risk of getting infected.
Hello, everybody. My name is Blessing Gope. For our group presentation of HIV, I'll be talking about the treatment of HIV. There is no cure for HIV infection, but there are treatment options that can help people living with HIV infection to live longer, healthier, and productive lives. Such treatment-related activities include vaccine research, drugs trials, creating prevention strategies that can help stop new infections. In India and Thailand, generic drugs makers have produced a range of effective antiretrovirus therapy that combines multiple drugs into single tablets. This helps to reduce the pill burden to one tablet twice daily. The treatment for HIV involves taking medicine that will help slow down the progression of the virus in the body. This type of virus is called retrovirus. The drugs used to treat HIV are called antiretrovirals, ARV. People living with HIV are recommended to start antiretrovirus therapy as soon as they are diagnosed. There are six main types of antiretroviral medicine used to treat HIV infection, and they all work in different ways. The typical treatment regimen involves taking 2 to 3 of 6 different kinds of antiretrovirus medicine. It makes it harder for the HIV virus to become resistant. It will also help minimize how much HIV can replicate in our body. Isentry is also HIV prescription medicine used with other antiretrovirus therapy to treat HIV-1 infection in people 4 weeks of age and older. These antiretrovirus medicine includes fusion inhibitors, CCR5 antagonist antiretrovirals, nucleoside reverse transcriptase inhibitors (NNRTI), non-nucleoside reverse transcriptase inhibitors (NNRTIs), integrase inhibitors, and protease inhibitors. These are our references that we use for our HIV infection. These are all the various references that we found our research on.